Hello everyone. In this video, we are going to learn about what is meant by patient counseling. Its definition, outcomes of patient counseling, what are the steps to be followed during patient counseling, and barriers of patient counseling, how to overcome the barriers of patient counseling. These are the steps we are going to learn about in this video. First of all, definition. What is meant by patient counseling? Patient counseling is defined as providing information to the patient or patient's caregiver regarding the disease, medication, diet, and lifestyle modification in layman language to achieve the desirable therapeutic outcomes. The information may be given verbally and complemented with written information leaflets. First of all, what is meant by patient counseling? Patient counseling means providing the information to the patient, giving drug related or disease related, diet related, or any lifestyle modification related information to the patient, because patient will be unaware of the diseases, unaware of the medications. So that we have to give all the medication related informations, disease related information, diet based informations, what are the diet to be followed, what are the lifestyle modifications to be taken in the layman language. And layman language means patient understanding languages. Why we should counsel the patient means we have to obtain a desirable outcome, therapeutic outcome. Our outcome should be improving the quality of life of the patient, reducing the side effects, and giving a safe and effective treatment, and reducing the symptoms of the diseases, and improving the life of the patient by reducing the diseases. These are the therapeutic outcome. This can be obtained only giving the advice to the patient, all the informations to the patient. Then only they will be aware of the proper usage of the medications. Some patients will miss the medication. They will not know importance of taking the medication. So we should advise the patient, do not miss the medication, proper taking of the medication, what to do when the side effects occur, what to do in minimal side effects, or what to do in moderate side effects. This all the information we can give. Lifestyle modification, not only the drugs, the lifestyle modification also changes the change can help to achieve the therapeutic outcome. So along with the lifestyle modification, taking the medication will easily improve the therapeutic outcome. So we have to also advise about them about the diet, lifestyle modification, and all. By understanding the diseases only, they will know in which stages they are in complicated or in low stages. We should not give fear to the patient by advising them about the disease. We should tell them about the diseases, which is we can inform them. They should know which disease they gone through, and how can they prevent the disease, how can they control the disease. This all information we can, as a pharmacist, this is our role to inform to the patient in the layman language, their understanding language. This information can be given verbally. Verbally means we can give this information in by saying the information, or in a non-verbal manner also we can share the information. Non-verbal means through actions. Through actions also we can share this information, and complemented with written information leaflets. Some leaflets, the forms like leaflets in paper, we can print it and give it to the patient. If the patient has no time for patient counseling means, we can print the leaflets and give it to the patient, so that they can take it to home, and they can read it and understand it. It should be in an understanding manner, in an easy manner. so that if they had time in a home means they will easily read and understand it. This way also we can give patient counseling. Then outcomes of the patient counseling. What are the outcomes? Patient will understand the importance of the prescribed medication in management of the diseases. They will understand the importance of taking medications. Some patients, mostly in India, some old age group peoples who are uneducated peoples, they will not understand the importance of taking the medication. They will easily go, if life is going on means they will, it's okay, they will leave it, they will not take the medication, and so that we should properly explain about the importance of taking medication. If they skip any medication, what will happen, we should inform them clearly so that they will properly take each the medications in a correct manner, in a prescribed manner. Improved medication adherence. Medication adherence means is taking the medication without skipping them. They will, by advising them the importance of medication, they will take the medications without skipping. So, improved medication adherence. Achieving the desired therapeutic goal. Yes, by taking proper medication, proper diet, proper lifestyle modification, the therapeutic goal, the outcome will be improved. Outcome, what are the outcome? Curing the disease. They will be improved. And then reducing incidence of adverse events and unnecessary healthcare costs. And if by some taking some medications will cause side effects, like changes in the urine color or irritations, or dry mouth. These are the side effects, minimal side effects. By how we can prevent the side effects and all means by taking more water. We should take more water so that these kinds of side effects will be avoided. So we can inform the patient by when you take this tablet, you should take it with more water. And sometimes we should take avoid milk. Calcium related tablets we should say avoid milk, prevent the side effects. So in some BP taking tablets means we should it will suddenly cause hypotension, so that you should say them lie down if you feel any dizziness, like that. So we can inform them about the side effects, so this can be prevented by, so that the incidence of side effects will be reduced and unnecessary healthcare costs. By increasing the side effects, there will be unnecessary health cost. There will be treatment improvement. Then for improving the side of for preventing the side effects, there will be more treatment cost. There will be more treatment cost, so that we should say them about the proper usage of the medication. Improved quality of life. The quality of the life will be improved by taking the proper medications. Improved professional rapport between the patient and pharmacy, leading to an improved patient patronage to the pharmacy. Yes, there will be, by doing a counseling, a proper relationship can be developed between the patient and the pharmacist. By saying, by building a trust, counseling plays an important role for building a trust between the patient and the pharmacist. So by providing providing a trust, we can collect all the information from the patient, and also they will, by building a proper care, by doing counseling, there will be a great relationship will be built between the patient and the pharmacist, so that they will not skip any advices given by the pharmacist. They will understand, they will trust you and to take the medications. If the pharmacist says, means it will be right, they will think, and they will take the proper medications. So a complete relationship will be built between the patient and the pharmacist. Next outcomes, effective patient counseling is not simply providing the information. Yes, once effective patient counseling means it is not simply providing the information and all. This is not simply providing an information. The timing, organization of the information are very important to improve the patient's understanding and motivation to follow the instruction given during the counseling session. Yes, a proper timing has to be maintained, because some patients will not have more time for counseling and all. So we should maintain a proper timing. Half an hour means within half an hour we should completely stop the section by giving all the information. Within a time we should organize and complete it. Organization of the information means we should completely do it professionally and organizable manner. We should inform, we should do the counseling in a 4 steps manner. First, we should inform the patients. First, we should collect all the information. Then, from the patient by asking the questions. Then we should, after that only, we should give the proper first drug-based counseling, disease-based counseling, diet, then lifestyle modification. This way, we should properly organize the counseling section. Then we should ask in last section, we should ask the questions, whether they understand about them completely. We should know, right? So that we should ask the questions. If they answer it properly, means yes, the counseling session is over. So we should do the counseling session in an organized manner. Then, often in community pharmacies, pharmacists are very busy in filling the prescription. Yes, and patients are in hurry to receive the medication. Every patient receiving medication should know about how to use them, but in busy practice, it may be feasible. Following guidelines may be used to identify patients who need counseling. Yes. Mostly in community pharmacy. Community pharmacy means outside pharmacy. Not hospital pharmacy. It's in the outside pharmacy in a village or in a area. There will be one pharmacy, right? Community pharmacy. In that pharmacy, pharmacists will be busy. There will be some pharmacists only, 3 or 4 for a particular period of time. There will be some 4 or 5 pharmacists. They can't counsel the patients. They will be in busy schedule. There will be their first main role is checking the prescription and filling the medication and dispensing to the patient. This is their main role. So they will be busy in checking and filling and dispensing. Then patient also have no time, will not have time. Before that only they will go to hospital and spend time there. Then they will have less time only. In that time they will purchase the medicine. Their main role will be purchasing and medicine and go to the home is their main duty will be this one. So in a community pharmacy, their counseling is rare. Counseling they can't counsel the patient because of lack of time, and there will be no lack of space also. Mostly in community pharmacy, there will be space will be short, small, so that space also there will be not. So in that time, counseling, we can provide counseling only to the patients who need counseling according to the guideline. We can check the guideline. In checking the guideline, they will give information. For this kinds of patients, this disease patients will need counseling, so that we can counsel this kinds of patients only. Mostly chronic disease patients we can counsel them. there are kidney related patients also, they will need counseling. Lifestyle modification they will need necessarily. So we can counsel them, and we can counsel every patient. There should be one in that busy schedule community pharmacy. Also there can be one person for checking the first check the prescription, then filling and dispensing. The other pharmacists should do this kinds. Then there will be lastly one pharmacist. That pharmacist, what should he do? Means he should check each medication and say one note about this medication to the patient. How to use them. There. So every patient who are taking the medication should aware about how to use that medication. So this is the main role of the pharmacist. He should inform about not missing the doses also. These are the outcomes after patient counseling. Often community is this is the outcome of patient counseling. Next one is stages of the patient counseling. What are the steps? Introduction, content, process, conclusion. Introduction. In introduction section, mostly first is introduction. Review the patient record prior to counseling. First, before starting the counseling, the pharmacist should review the patient record. She should know on and off about the patient records. Every information he should review it clearly. All informations like subjective for what the patient is admitted, for condition, the patient is now in which medications, and how he should know about what are the treatment going through in a hospital, what age is the patient, is the patient is conscious, and the patient is almost healthy or not, or in a worse situation, and tell patients everything. He should review every records of the patient. Conduct an appropriate patient counseling introduction by self and patient. Yes, he should conduct a patient counseling between self introduction. First, he should give a self introduction. He should arrange the patient, and ask them whether they have a time for the counseling session. If they said they have a time, or then if they have no time means also we can say them about the benefit of patient counseling. And after saying the benefit of patient counseling, then also we can ask them whether they have time to continue the section. Whether they have no time means we can give them a leaflet based on that diseases. Or if they have time means we should self introduce ourselves as our name and our profession, like that information. And we can also ask them their name, their profession, what their work, like that we can develop a trust between them. Explain the purpose. Yes, we should explain each benefits of the patient counseling section. Obtain pertinent initial drug related informations. Drug related information means other in patient records there will be less information means only. Other all kinds of information we should be gathered from the patient itself. So if the we should after developing trust only we should inform them about the confidentiality of the information. We will not share this kinds of information to others, so that you can say all kinds of information, can share all kinds of information to them, with them, with us, so that we can this will be helpful for your disease cure. So that we can based on this we can adjust drug therapy. So you should share each and every kinds of information with us. We should inform that. Then we should ask them about if they have any drug allergies, whether they experienced any allergies from their childhood. We can also ask with the patient caregivers and all. If with the patient is a geriatric patient, pediatric patient, or the patient was in other risk condition and all, means we can gather this kinds of information from the patient caregivers. Then drug allergy information we can gather, other medication, whether the patient is taking other any medications without prescription, means we can also ask this outside what is the medication, whether the patient is taking like that, or the patient is taking any diabetic, whether the patient has any diabetic past medication history, diabetic or hypertension, whether they are taking the medication. We should also ask them about what are the medication they are taking. Warn the patient about taking is then after gathering the information, what is the drugs and all, we should inform them about the risk of taking this kinds of medications. What is the medication, herbal, botanical drugs, this alcohol, social history also we should ask the patient. After building a trust only, they will frankly say about the social history. Like they are a smoker or alcoholic, how many years are they are smoking, they are alcoholic, and how many drinks they will take one day, how many cigarettes they will take one day. Like that information we can ask to the patient, and we can say them about the risk of taking the what is medication, alcohol with this medication. Doctor prescribed medication, the risk of taking this alcohol, alcohol will interfere with the drug absorption of the drugs, and it will also cause more side effects, right, by taking alcohol along with this medication. You should also inform them about this. Assess the patient understanding for reason of therapy. Then we should inform them about the therapy disease. We should inform understanding disease, what is your disease, what from which the disease was came, what are the some other information we can share it, and we can also ask any questions about any question, what is this disease, like that, whether we should know, right, whether the patient is understand about the disease or drugs. So we can also ask the questions, assess any actual or problems of importance to the patient. And last we can ask in introduction session, last we can ask whether they have any problems, like they can share, right, share it with us. So we can also confidentially ask that any problem you are dealing with, any stress you are dealing with, whether you are afraid of this condition, like that. Then we can advise them, this is how many people are cured from this disease by taking the proper medication, like that we can encourage the patient. This only from the introduction session. Next one is counseling content items. Counseling. Now only we are starting about the drug related counseling. We should take and say about the name of the drug, each and every name of the drug, each drug name and indication of the medication for which this medication is prescribed. Indication means uses. What are the uses of this medication, for what the prescriber prescribed this medication. Next, dosage regimen. A dosage regimen is means in which dose this drug is given. Duration of therapy, when appropriate. Duration, for how many days you should take this medication. This all information. Assist the patient in developing a plan to incorporate the medication regimen into. Then we can explain about plan for in which plan the patient can the patient will, if the patient have chronic diseases means he should take more medications, right? So we can plan about that. We can give a plan how they can take the medication and all. How they can they should not skip the medication, right? So how they can not skip the medication and take it properly. We can also say about setting an alarm. By setting an alarm, they will come to remember, right? By in which time he should take means he should set an alarm at that proper time. Then they can easily remember of taking the medication. Then explain how long it will take for the drug to show its effect. Some drugs will not show the effect immediately, right? They should mostly every drugs will not show effect. Chronic diseases drugs will not show effect immediately. There will be we should give must proper time for showing the effect. We can explain them about in which time it will show proper effect and all. This kinds of information we can share it to the patient. Discuss storage and refilling information. Yes, storage, in which condition we should store this medication. Storage means room temperature. Some insulin like injections we should store it in a refrigerator, right? We should not freeze it. We should store it in a refrigerator so that we can inform in which storage we should store the medication and refill the medication. Refill means some medication we will, chronic disease cases they will give medications for 1 month or 3 months and all. In which month we should refill the medication, which month you should re-see the prescriber and all. This kinds of information we can share it here. Emphasize the benefits of completing the medication as prescribed. Yes, what are the benefits of completing the medications? The prescriber will prescribe the medication, each medication for the proper reason only. So in which condition, in which what are the benefits? Benefits means reducing the diseases, the benefits of taking this medication, which can say the what are the benefits. You will deal with taking the medications in a proper manner. Then discuss the potential side effects. We should inform them about what are the side effects you will face while taking this medications. If you like urine color change, dry mouth, these are the common side effects. Bitter taste, these are the minimal side effects. What you should do means drink more water, like that information we can explain. Then there will be more major side effects. Major side effects like skin irritation, fluffing, edema like around the mouth. These are the allergic like symptoms, side effects. So if you get this kinds of side effects means you should go to a doctor immediately. You should not keep it, right? So this kinds of information you should say to the patient. Discuss how to prevent and how to prevent the side effect, how to manage the side effects. We should inform the patient by preventing the how to prevent the side effects and all. Next one, discuss the precautions. What are the precautions we can take? Precautions means what are the like drinking the water. These are the precautions we can take, right? For side effects. Then if diseases are sometimes happens means you should lie down. These are the precautions. Then discuss significant drug related problems. What are the drug like alcohol? While taking alcohol, you take this kinds of medications means we will have major side effects. So we should inform about the drug related side effects, drug food related side effects. What are the antacids also will interfere with some kinds of drugs. It will like pantoprazole by while taking rabiprazole and all, antacid will reduce its absorption. So we can say about to avoid antacids while taking these medications and all. Drug food related side of interactions. Drug food related interaction. What are the food we should avoid, like milk? This also calcium drug absorption will be calcium will be deposit or its absorption will be prevented by while taking milk interference, so that we can also inform them about it. Explain precisely what to do if the patient misses the dose. What other precautions we can do if he misses the dose. If the patient misses the dose, if the patient have a morning dose and a night dose only, means if he remembered it around 11 o'clock, means he can take the medications. If the patient have morning, afternoon and night dose, if he remember around 11 o'clock, means he should skip the medication and take the medication in the afternoon medication. He should not double the dose. These are information we should share. Explore the potential problems of the patient. Then what are the problems the patient having? Then we should explore. These are the contents. Next one is counseling process items. We should use the proper language that the patient's understanding language only we should use. Then use the appropriate counseling aids. Counseling aids means leaflets. These are the counseling aids. This can be used during counseling. Present the fact and order in logic order, or use open-ended question. You should ask whether you will take this medication. Yes or no questions like that. You should ask them. Use both verbal and non-verbal behavior. Verbal means by talking. You should conduct the counseling, or actions, using action, both actions and verbal and non-verbal manner. We can use this counseling section. Counseling, like last one, conclusion. Verify the patient understand. Yes, until now you have done the counseling in a proper manner. Then we should know about the understanding of the patient, right? Understanding only we can we come to know we have done a proper counseling or not. So that understanding we can ask them a question. By asking the question, we will come to know whether the patient is understand everything or not. Then after asking the question, we can explain everything. Come from front to back, like first to last, we can explain it shortly. What are the drugs, indications, dosage, duration, side effects, fastly. We can lastly as a hint notes means like hint notes, like we can explain everything. These are the introduction, counseling session aids, then content items, then counseling process items, then last one is conclusion. Then barriers of patient counseling. What are the barriers we face during patient counseling? There are following, mostly in India, there are three major barriers: patient-based, system-based, provider-based. First one is patient-based. Counseling happens only when patients show interest in receiving the information. Yes, only counseling is done with the patient interest only. Yes, if the patient show interest only, if the patient has time only, we can do a counseling. Whether if the patient has no time, no interest, means we can't say anything, right? So Patient interest is also play a major role in counseling session. If they are in hurry to reach home, yes, if they have no time, they have to go to home means we can talk to them. They will be in hurry berry manner, so that we can do a counseling, right? Time is a major barrier. Gender differences, gender difference also we know that they will also play a major role. Language is a major drawback. Patient don't know our language means then we can't explain them. Literacy, the patient is uneducated means they will not understand it is in a proper manner. But if we explained it is in a proper manner also, they can't understand it properly clearly. So that these are the barriers. Patient related barriers: first, they have no interest, no time, gender difference, language difference, literacy. Then system-based barriers. System-based barriers means lack of reimbursement due to non-legalization of patient counseling, lack of adequate space. Yes, non-legalization of patient counseling. Um, Legally, in some area there will be no legality. For patient counseling, they will not show legality. There is a non-legalization. Lack of adequate spaces in community pharmacies, small pharmacies, and there will be no space for to conduct a proper counseling. There will be sound. Yes, sound, so that we have more disturbance during counseling. So adequate space is not there. Then trained staff, yes, mostly in India, in a community pharmacy there will be D form educated and B form educated people only, so that they will not know proper information about the drug. They have no understanding about the diseases also, so that trained staff has to be, there must be trained staff to conduct the counseling. And the busy hour, yes, in a pharmacy, main role of the pharmacist is to dispensing the medication, so that they will be busy in that way, so that the counseling is for counseling they have no time. These are the system-based barrier. Most system-based barrier is non-legalization of the patient counseling, lack of adequate space, trained staff is not there, unavailability, and the busy hour of the system-based barriers. Next one is provider-based barriers. Provider-based barrier. Provider, who is the provider? Pharmacist is the provider, right? In India, majority community pharmacies run by pharmacists having diploma. Diploma people only run the majority of the pharmacists, and in India mostly down degree not a pharmacist can also do a counseling, uh, will also dispense the medication in the pharmacy. So they have no education and all about the proper information about the drug, they don't know. So that this is the major drawback. Their knowledge is they have no appropriate knowledge to conduct the counseling. Their commitment towards counseling are inadequate. They will not understand the major role of the counseling. We know, right? We know the importance of the counseling, but for them they don't know about the importance of the counseling, so that they will not take that counseling in a serious manner. So this is the drawback. Next one, lack of interest. If the pharmacist has no interest for taking a counseling means this is also a drawback. Lack of time, yes, pharmacists will not have a proper time to conduct a counseling session, so lack of time is also a drawback. Lack of knowledge, lack of confidence. Some pharmacists will, mostly not a pharmacist, all of them have lack of confidence about their knowledge. Lack of training is mostly they have no training about the counseling. Yes, they are the provider based barrier. Provider first is qualification, lack of knowledge, lack of interest, time, confidence, training. These are the provider based barrier. There are three types of barrier: patient, system, provider. Patient related, system space and all related, provided as pharmacist related. Next one is strategies to overcome the counseling barriers. What are the strategies we can do to avoid this kinds of barriers? To overcome the patient-based barriers, following strategies. Patient-related barriers, we can do the following strategies. Use multimedia materials. Yes. We can use some materials like diagrams and all, so that they will be easily interestingly they will hear about the information. Pictograms means the graph like grams, oral or written the information. We can give leaflets, we can provide aids, follow-up schedules like that. If today's counseling means we should inform them about the importance. Then we can inform the counseling importance of the counseling session and all. Audio visual tapes we can use. Audio tapes, what are the audio tapes? Like that we can use tailored prescription instructions. Prescription instruction we can give. Legalization of the patient counseling, introduction of the counseling fee, and conduce professional development. Yes, what are the legal action of the patient counseling section? We can also overcome the counseling section by barriers of counseling section by providing a space, more pharmacists to work, improving their training of the pharmacist, and then we can improve it and provide the proper counseling, so that we can improve the therapeutic outcome, because the counseling session play a major role in the therapeutic outcome. And we can also find the drug related problems, side effects and all, so that we should come to know about everything, each and everything about the. We can build a proper trust between the pharmacist and the patient, so that we can do right. A counseling session where, if the counseling session is done, we can improve the therapeutic outcome. So we should inform them about it. We should inform everything about the counseling session, and we should encourage the patients to come and attend the counseling section. What are the information we will share in the counseling session, and then we should explain them what are the benefits of the counseling section. Also it has to be explained, and encourage the patients about the counseling. And this by this we can overcome this counseling related barriers. Okay, in this video, what are the what we have learned is what is counseling, patient counseling. It's a definition we learned here. Definition in this definition, what is the mean by patient counseling? Um, what are the counseling we have to do? Disease, drug, diet, lifestyle. In which language, layman language, we have to explain what are the importance of the patient counseling to improve outcomes. Outcomes is to improve the patient quality of life. Important side effects is has to be minimized. Everything we should explain, right? Then stages of the patient counseling. First are the stages: introduction, content, process, conclusion. Introduction, we should explain, ask the outer patient records related questions. Counseling outer content items only, we should explain about the name, age, name, indications, duration of the therapy, drug related side effects. Counseling process is in which language has to explain. Counseling conclusion. Last we have to ask the questions. This are comes under the stages. Then barriers. Barriers means patient based barrier system provider. We know that patient means no interest, no time, gender difference, language, literacy. System based means lack of adequate space, trained staffs, busy hours, non legalization. Provider based, knowledge, lack of interest, lack of knowledge, lack of time, lack of confidence, lack of training. These are strategies. What are the strategies to overcome the barriers? Strategies by improving the pictograms, audiovisual tapes, like that, tape, prescription, oral or written informations. These are the, in this way, we can overcome the counseling barriers. Thank you.